This podcast was produced by OAR FM Dunedin with support from New Zealand On Air.
It was 7:11 a.m. and it started with the dispatcher for the region that I work in Brooklyn dispatching a cardiac arrest. A couple seconds later, he dispatched another cardiac arrest to a different unit. And then about a minute after that, he dispatched another cardiac arrest to a different unit. And this went on for 11 days. We were seeing upwards of, I think at our peak, we saw 326 cardiac arrests system-wide in a 24-hour period in New York City EMS. We were not reviving anyone.
Welcome to the OI podcast, the Otago Institute podcast, conversations with experts from the worlds of arts, sciences and Mātauranga Māori, brought to you by the Otago Institute, the Otago branch of the Royal Society for Arts and Sciences. Kia ora, no mai, haere mai. For those of you new to the podcast, welcome. You have found the OI podcast. I'm Dr Barb, a quantitative ecologist with a background in modelling, climate change, biodiversity, conservation prioritisation and SciComm, and a PhD in botany from Otako Whakaihu Waka, the University of Otago.
And kia ora, I'm Trudi and I'm just interested in a whole lot of stuff. And I don't have as many certificates to go with it, but I'm just...
Somebody's got to be the audience, so yes, we'll go for it.
Today's show, episode 139, Behind the Mask with Paul Trotman. And we're talking about the mask. Now, it's a tricky one, this one, Behind the Mask, because if you look it up on YouTube, you will get an array of different things, from Michael Jackson to
who's that guy with
Phantom
the
of the
green
Opera
and the green mask? That American actor,
Kerry.
Yes,
is it? Yes. No, you get a whole lot of things. So it does help if you link in Behind the Mask, Paul Trotman. It is about COVID. So we have today in the studio Paul Trotman. Welcome.
Kia ora.
And thank you very much for coming along. Paul is a writer, doctor, filmmaker and lifelong patient, although not necessarily in that order. He's written a newspaper column, film scripts and sitcom for the BBC. He's had cartoons published in Private Eye magazine, which I guess, are people familiar with that here?
I would hope so.
I feel like people know what Private Eye magazine is. Produced professional theatre in Dunedin and shows at the Edinburgh Festival. When he has time, he collects old medical stuff and signed books. He has developed and written, produced, directed, presented over 40 hours of commercial television and 2 feature documentaries, one about human dissection and the other about frontline COVID workers. And it's the frontline COVID workers that we're really focusing on today.
So after all that, I feel like I need to lie down on a strong cup of tea. Do you sleep, eat, I'm
not even finished.
There's more. Wait, there's more.
As none of the aforementioned pay the bills, he also has a part-time day job as an SMO, which is a senior medical officer at Balclutha and Oamaru hospitals, and can occasionally be seen moonlighting in Dunedin's urgent doctors. Wow.
Crikey, yeah.
That is a lot. So
how do you...
Yes, so where do you start? Did you start with your love of film and kind of literature writing, or did you start with your medical doctors and one came into the others?
I did my medical degree, and I was always interested in writing, and I wrote and produced and directed a comedy show of sort of 10-minute episodes on student radio on Radio 1. I did a regular Radio 1 music show, which was, what's the word? I usually say wanky English rock.
Right, wanky English rock. What does that look like when it's at home?
Pink Floyd, Peter Gabriel.
Oh, see, I love Pink
Genesis,
Floyd.
Marillion.
I thought you were going to say the Bay City Rollers.
I remember the Bay City
So do
Rollers
I.
just when I was a kid.
They're the tartan. There's a tartan pajama bottoms.
Yes,
aren't they?
that's them. That's them. No. So the sort of political, complicated Dark Side of the Moon.
I love
There's
Dark
another
Side.
English.
Dark Side of the Moon has got to be one of the best albums ever produced.
There's another English band who I'm a big fan of called Marillion, who were quite big in the early 80s, and then their singer left, but they invented crowdfunding.
Oh,
and
really?
so they were the first band to crowdfund an album, and I've been lucky enough that when I was making my dissection documentary, I got in touch with them. And I said, I'd really like to use one of your songs at the end of my film. And I got this email back that said, yeah, that's fine. And I sort of thought, oh. And I emailed them back slightly nervously and said, what's it going to cost me? I haven't got that much money in my budget. And they said, have it with our love as long as you credit us.
Oh, how nice is that?
And, they own the rights to it. They're an independent band. They don't, record label doesn't own the rights to anything but their very early stuff. And they let me use it. And they've let me use songs of theirs at the end of a couple of other documentaries, including Behind the Mask.
Oh, interesting. And did have an amazing soundtrack, actually, I would say, Behind the Mask. And, of course, it is available just on YouTube for free.
Yes.
Anyone can go and watch it.
Yes.
Which is lovely. Thank you. That's...
the other music came from the Sound Room in Auckland and a Dunedin musician, Alistair Galbraith, also. I got some music from him too.
Cool. So what I'm going to do now is I'm just going to play one of the tracks.
Well, we're not done until all 50 states are done. Because you get in your car and you drive 4 hours and you're all of a sudden in a state that's just starting to ramp up.
It's rising in the US. The cases are rising. We don't have testing, we don't have PPE, and we're going to open the country. We have no preparedness, but we're going to open the country. And there are people running around in the street with guns. I'm like, what are you going to shoot? The virus? Honestly, what are you going to shoot this time?
Quite a moving little clip, isn't it? So it's one of the trailers from Behind the Mask. And it's not actors. That's actual frontline workers from America. And I wonder if we could just talk a little bit about how you came to get this footage.
I was put off work when COVID came because I'm immune compromised, and I was sitting at home and I thought, well, what can I do? And I had another idea which didn't quite work, and then I thought, I know, I'm going to do what I normally do. And I had this sort of feeling that there was going to be a strong effort to forget what had happened and to forget and downplay the extreme bravery and the things that my colleagues were doing around the world to keep going and to keep looking after people in the middle of this horrendous pandemic. And I thought, I need to document it, and I need to document it now. And so I started reaching out to anybody I knew who may or may not have contacts overseas or who was overseas. I posted on Facebook, I emailed all my medical friends in other countries and just made links. So almost everybody in the film, not quite everybody, but a lot of people in the film has a connection to New Zealand. They're either a New Zealand trained doctor working overseas. So one of the people you heard there was Terry Inda. She was in my class at med school, and she was at the time working at one of the very big hospitals in the States on the East Coast, and she was happy to be interviewed. There's another person, Akua, who worked in one of the rural hospitals here in New Zealand with me and just made contact with her. And those people then put me in touch with other people who put me in touch with other people. So, for instance, Terry put me in touch with an anaesthetist she knew, and he did a great interview, and he happened to also be a professional photographer with a drone. So that's where we got the drone footage of Brigham and Women's Hospital in Boston. And other people put me in touch with other people, and I just interviewed anybody who would talk to me. And I did it by Zoom, and I realized that Zoom has a recording facility, and it's actually not bad, as long as the link is okay. And what it does is it stores the footage in the cloud, and you then download it. So it's only their link has to be good.
Right.
And as long as their link is okay, and most people in the Western world have an acceptable link now. I did have a few people who I wanted to use, but who I just could not get decent sound or decent pictures, one or the other. And so they had to sadly be dropped. And I said, I would get up in the morning, I would send a bunch of emails, I would check my replies, I would schedule 2 or 3 interviews in a day, and then I would Zoom do a couple of them, then I'd go for my daily walk and take photographs and video of the empty streets, which ended up in the film, come home, do another interview, and then just stored them all on a hard drive.
Yeah. So were you based here in New Zealand at the time?
Yeah.
It's quite amazing, isn't it?
So all of the interviews are done remotely by Zoom.
All of the interviews are done remotely. So I do think it's an interesting point, because I think there was a tiny proportion of the New Zealand population who I think had a really, I'll say a good, but not a perfect, because we weren't there, right? But had an idea of what was happening in some of the places that were really badly hit, like New York and Boston and some of those East Coast places in America, before the vaccine came out. So that bit before the vaccine came out, where New Zealand didn't have the virus. So we had that long bit where we just didn't have the virus. And of course we had the lockdowns and the quarantines and people not being able to come back to New Zealand, and that of course meant people didn't want to leave New Zealand. So there was kind of that thing. But I think the actual, like the visibleness of people actually dying from and being very sick from COVID, I think we were very sheltered from that here in New Zealand. And I think in some ways, and you can agree or disagree with me, but I wonder if that being sheltered from the actual realities on the ground has made the kind of anti-vax movement and the political backlash post-COVID. And, we're not really post-COVID because there's still COVID around, right? So, or post-vaccine, I wonder if that's kind of part of that.
I think there's a bunch of reasons we did so well. The first is that we have 1,000 miles or 1,000 kilometres of sea in any direction to the next nearest place. So you couldn't just walk across a border.
We have good borders. We have easy borders to shut down.
Easy borders to shut down and protect. We had a political scenario which was happy to take expert advice.
And decisive.
Yeah.
And I think both parts played their role. Like the political did this and the Director General of Health did this, but
So we had Ashley Bloomfield, we had Michael Baker looking at the numbers, crunching the numbers, coming up with what we needed to do, and we had a Prime Minister who was happy to take that advice.
And also, of course, Susie Wiles did
and Susie,
an incredible job of just keeping the public, and I think a lot of politicians kind of understanding what was happening and how it was happening and why it was happening and that sort of thing. So I think, and it's very clear from worldwide reaction that New Zealand's response and the way that we were able to deal with COVID was like world leading.
Yeah,
and our death rate shows that, which was people did die here, but proportion to the population, much, much, much lower than overseas. But I wonder what effect that has now on our post-impression of the whole pandemic, because I think people in New Zealand, we remember the lockdown, and maybe this is all across the world, but we don't actually remember very well the effects of COVID because we didn't have those mass deaths from it.
I mean, you just have to look at that graph of world deaths versus time, and there's this little line right down the bottom with a sort of a gap before the next lowest country, which is New Zealand. And we didn't have that horrendous, massive deaths. But to be honest, a lot of places, particularly America at the moment, is denying it ever happened again, and is denying that the reason that they had such a high death rate in America is because they basically had a president who kept telling people to ignore the best
medical advice.
The best medical advice. And that's why they had a death rate that was so high. But also the fact that they had hard to protect borders, they had land borders at two sides, they had big ports, and it was already taking off there before. We also had the warning.
Yeah, I mean, I wonder if, in fact, the borders played very much of a role in America because it was already in America before they knew it, basically, and I don't know that there was so much of it coming into him. And I mean, obviously, to start off with, because they had it there, one of the first places to have got it outside of the immediate. I mean, it was one of the first places there, and I think Italy was the other one, Northern Italy.
I spoke to the ED specialist in Italy who faced it, and it's just bad luck for Italy. They had a flight with people on it, they had, and you got to remember, as soon as you've seen one case, there are 10 cases that you haven't seen at least. And so when it did finally break out back here in New Zealand, I happened to be in Auckland, and there was a single case picked up in Auckland, and I said, I'm sorry, I'm going to have to go home. And I immediately booked on the next flight, and I was probably an hour ahead of everybody else. So I got on my next chosen flight and came back home to Dunedin, because I couldn't afford to get stuck in Auckland.
Yeah. I'll never forget the footage from the ED department in Italy. I don't know if it was on the news, Al Jazeera or BBC World. It was horrendous, and I just think, if that comes here, I nearly said a rude word.
I know, but the thing is that, like, the hospitals just were unable to cope with it because the sheer number of people needing such critical, and like all elective surgery was just cancelled for months and months and months and months and months. And, it was because the care was so intensive and because so many people were dying. I mean, I watched the Behind the Mask this morning, and then it flicked on to another documentary from a foreign correspondent, and that
might have been the one.
They were just showing, like, they just said, we ran out of stretchers for the bodies. We didn't have room in the morgue. We were running out of stretchers, and we couldn't film. Like, the hospitals didn't want anything filmed because it would reflect badly on the hospital. And I think that kind of self-censorship meant that a lot of people didn't get those raw images in their minds of exactly how bad it is. And I think, there's no way that our medical system, which is stretched now, with no COVID, with no pandemic, it's in a normal day we get our EDs being shut down because they're overworked and they've got waiting and they've got ambulances outside. And then if we had that very first pre-vaccine COVID here, it would have been absolutely chaos.
I did the maths, and for a town like, say, Oamaru with a population of 20,000, if the COVID had hit just Oamaru, working out the number of cases that end up in intensive care, there are not enough intensive care beds in New Zealand to take the people who needed them from just Oamaru.
Yeah. I mean, when you look at those numbers, you just think, And I think that's how lucky we were, just as you say, by where we happen to live, at, in the bottom of the Pacific in a place. But, it could have been that one of those flights had arrived here on the shores and we had it before we knew anything about it. That was luck.
Yes, that was luck. But we did have cases in New Zealand, remember? But Jacinda listened to the experts. We went into lockdown and people did it. People did their lockdown pretty well. We didn't have the nutcases saying, I'm not going to wear a mask and I'm just going to go out shopping like everybody else. We didn't have that. We had people respecting that. They went out People wore their masks if they went into crowded places. They queued to go into the supermarket. They waited outside. And so we actually eradicated it. We were one of the only places to eradicate that first wave of COVID. And then we had those months where we came out of lockdown. We were just blocked the borders.
Yeah.
And everybody could do stuff as normal. I went to a crowded house concert in Dunedin, and I still remember Neil Finn standing up on the stage and saying, "Welcome to the biggest concert in the world tonight."
Yeah, crazy.
And it was because we managed to eradicate it.
Yeah.
The second time around, or was it the third time around, when we got the new, more infectious strain, that was when it took off. But by then, most people were vaccinated.
Yeah, and that's the big thing is that vaccine. And I think that people kind of also, there's a tendency to forget how big a deal that was. I mean, basically, everyone who was working on anything similar in area stopped working on that and worked on getting a vaccine for COVID. All around the world, and governments through and research bodies through absolute masses of people power and money at finding a vaccine. And I think people forget, like, it was amazing how fast that happened. I mean, it was months, and I'm sure anyone working on the front line was going, "Oh my God, this is just, how are we ever going to last?" But actually, in terms of developing a vaccine, but I think the other thing is that a lot of people think they just started from scratch to make it. And of course, that's not the way vaccines or medicine or science at all works, right? Everything comes from something else. So there's other mRNA virus vaccines, and this is,
This is the first mRNA vaccine used, but they've been working on mRNA vaccines for 20 years.
Yeah.
And they've been testing them and so on and so on. And so the thought of them developing a novel vaccine from scratch that was a style that had never been used before in 9 months is ridiculous. They'd been working on mRNA vaccines for 20 years, and they were just about ready to go with them anyway when they used it for the COVID. And,
So they're working on, like, there's a novel part of it, obviously, because COVID itself was the novel part, COVID-19. And I think even just the fact that it has numbers after it kind of signals that, it's not the only coronavirus that's ever been. It's kind of a known group of viruses, but this one was particularly bad, particularly transferring and targeting humans.
The 19 is actually not 19th virus.
No, it's not.
2019.
Yes, it is. Sorry. Yes.
I got one right.
It's good to keep me on my toes there.
We
always tell I'm just going to say to the audience there, we always tell our guests that if we say something wrong, just correct us live on air. So well done there, Paul.
I think too that the response to get the vaccine up and running should indicate to people just how urgent the issue was.
Yeah. I think nobody in the science community and the medical fraternity across the world really didn't take it seriously. I think that's really quite unifying, I think. And what I would say is that one thing that really impressed me from you, and I see if I can find the right track here, one thing that really impressed me from Behind the Mask, the documentary. Is it a documentary or a movie? It's a documentary.
It's what's called a feature documentary.
Documentary.
So it presents more like a feature film than a television program.
Right.
It's longer, so it's 80 or 90 minutes long. It doesn't have things like a TV program will often have a tease at the start where they tell you what they're going to tell you, and has a sort of a series of little headlines at the start.
Yeah. But this is like a movie.
It just unravels like a movie.
But it's really a movie told in the voices of the people
on the front lines.
Yeah. And what really impressed me was the kind of breadth of occupations. So there were, the one lady who was the cleaner, she was a cleaner and her job was to come in and clean the rooms after someone had died. And so she was sanitizing and cleaning the rooms, and she was doing it every day, shift after shift after shift. And she would come in, she's completely decked in PPE from head to foot, and she said, I have a 7-step routine that I go through. I clean everything. I know when I've come into the room that someone has just died from COVID in this room. I go through, I clean everything. Everything has to be sanitized. And the film watches her while she's doing it, and she cleans the screen and she cleans all the cords. And she says, I just know that I have to do it 100%, and I wouldn't come in if I couldn't do it 1,000%, because I know that if I don't do it, someone's coming into this room and they're in danger. And I just think that's selfish of me if I didn't do it 100%. And she said, sometimes I feel safer in here because I know I'm completely covered with PPE than I do when I'm outside. But I just thought, God, what a job. Like, every day she's cleaning what's basically the same room, because there's different rooms, but they're all exactly the same. So she's cleaning the same room, which must be so mind-numbingly boring routine, right? Because you're just going through the same steps. But every single second of that, she was absolutely focused on what she was doing, so that the next person coming in and all the staff coming in had a clean room to come into. And just knowing that the room you're cleaning it because someone died of the thing you're cleaning off the walls that you can't see. And I thought that's, people, I mean, not that nurses and doctors, but it's not just the nurses and doctors. It was everybody involved in that kind of frontline staff.
Well, my niece is working in a private rest home in Sweden, and part of her job was as an orderly to pack up people's belongings to send back to their loved ones once they'd passed on with COVID. So, yeah, I think this episode might be a bit triggering for some people. I think,
but
I think it doesn't hurt to remember just what people experienced.
Yeah, I mean that must have a huge mental load on people, and people talk about PTSD, and I just, in some ways, I can't see how it doesn't continue for years after and be triggering for them as well.
One of my favourite bits in the film is Nikki Bennett, who's a nurse practitioner who at the time was in the US near Chicago, and she talks about spending a night with an elderly couple, both of whom have COVID. And the husband dies, and the wife is stuck in the bed with him for the rest of the night because she can't get an ambulance she can't get an undertaker to come and pick the body up until morning because they're all so busy. And so she sits there in the room with the wife, glancing over at her dead husband in the bed next to her, off and on for the rest of the night. And she just rages about how she can't do anything to help her. She can't even give her a hug, although she does, and rages about how COVID has taken away from her everything that she would normally do as a nurse. And yeah, it's a great scene. Interesting. It's a good example of, I usually say if I'm telling people about documentaries that television is a lie, documentaries even more so because they pretend to be real. And so if you look at that sequence where we have a nurse sitting in the window looking out and turning back to look at the person in the bed, the room was shot at a local rest home here in New Zealand, in Dunedin. The bed with the person's close-up of the person's feet in it and the bedside stuff was filmed at my parents' house, and they were just so carefully cut together by Stuart, the very good editor that we use, and you can't tell the difference.
Wow. Oh, that makes me feel kind of uneasy now. I mean, I think the difference is that all the shots of the actual people speaking their words are real.
That's real.
And we bought every single piece of COVID footage that we could find. We got some footage from an ED trainee in New York who walked around his emergency department with a camera. And we recreated some stuff. We were very lucky, sort of. Dunedin Intensive Care Unit was being rebuilt. Right. And they'd rebuilt the new part, and they just finished rebuilding the old part to match the new part because it's in two halves. Right. But they couldn't open it because there was a problem with the ventilation.
That's right.
So they let us go in there and film in some of the cubicles for doing recreations, because you need pictures to tell a story. If you're telling a story, you need to see pictures. Something. And
of course, in the middle of a pandemic, that's really difficult.
Yes.
Because everybody's busy doing stuff.
Yeah.
And having camera crews and, I mean, all of that just doesn't really go with it.
So Clive Copeman, who's a really great Dunedin filmmaker, camera operator and photographer. So if you ever need photographs done, get Clive to do it. He's great. Right. He's taken the only picture of me that I actually like.
Wow.
He and I went into the intensive care unit and spent 2 days in the intensive care in the closed part, filming recreations and stuff. And then we managed to get in the main intensive care unit them to all put on PPE, full PPE for an hour and do their normal job, but in full PPE, so we could get shots of a full intensive care unit with everybody in PPE.
And so when was this? Was this back in 2020?
Yeah, this was when New Zealand was just reopening, but people were still sort of semi-locked down.
Yeah.
And so it was basically an excuse to get out of the house.
Yeah.
And Clive and I went, we got some nursing students. We got a lot of the things are done by people who would actually normally do it.
It's a bit like a reenactment, isn't it?
Yeah. And so, for instance, the intubating a COVID patient section, the patient is a local GP who's a classmate of mine. The person doing the intubation is the person who teaches COVID intubation in the intensive care unit. And
because the first time you do an intubation, you don't want it to be someone who's seriously ill.
No. And in fact, you learn to intubate on patients in the operating theatre who are having surgery. But she was the person who did the teaching on how to intubate somebody with COVID. Which is a little bit different.
I was just going to say, how is it different?
You have to be a lot more careful about PPE. You don't get quite so close. And I'm not sure what else off the top of my head now.
I think it must just be so much more difficult.
There are a few things that you do where you connect tubes up sooner than you would normally to make a closed circuit, so you're not spilling COVID virus into the room.
Yeah, nice.
And so she demonstrated, and we came up with a way of doing it where you couldn't tell that it wasn't a real intubation. And so, yeah.
Oh, crazy.
And so there are people being zipped into body bags who are actually professors of law and are psychiatrists. That was Marie Bismarck, who was one of the people who helped us get some funding for the film, because it was done on the smell of an oily rag.
Yeah.
But we got one lump of funding from Marie from a fund that she has at the University of Melbourne. So we put anybody who had helped us with funding, who wanted to be in the film, got to play a patient or somebody in the background or
cool.
somebody
now,
clapping.
If I had known that, I would have volunteered to be a patient. Next time. No, don't have another pandemic just so I can be on film. Don't do that. I'm going to play another trailer here.
I would stand at the door of their bedroom and watch her turn her head every now and then and just glance over at his body.
Honestly, I used every tool I've learnt, knowing you're going in to face an unknown enemy.
The first thing I do is shed every stitch of clothing I have on before I come in the door.
My main fear was bringing it home to my little boy and to my husband.
I even walked out on the street with my really good neighbours that I'm very close to, and you could see them physically step back.
This, I think, is a trial run for something we really can't fight. That's going to be nastier and bigger, and if we continue the way we're going, it's an inevitability.
I finally understand what it means to be a veteran, and people thank them for their service, but Are you really thankful?
It did remind me that I wanted to talk about the impact on the families, and that's what, I don't know the name of the lady that was talking there, but it was a reoccurring theme of how, everybody who was working in those hospitals, in those emergency departments, in the ICU, they were risking their own lives, and the numbers come up on the screen, and I can't remember, it was something like 3,600 at the time when that it was at a point, I don't know where it was in the whole timeline of the pandemic, of the people who had died were actually medical people. They're the frontline medical people. These are people who are very healthy, who know the risks, who are taking all the precautions they possibly can, but they're just so in contact with the virus and so much of the virus that they are the frontline people who are dying.
We set out to find the names of every healthcare worker who died from the pandemic, and there are several sites who list those names, but there was only, I think, one at the time, and it was incomplete. So we got a researcher and set them to try and track down every single death, and we list the names of every healthcare worker who we could find the name of who died during the pandemic at the end of the film.
Oh, that's great. Yeah.
And it's, because I think it's something that we really forget as well, is that there's a kind of an idea that it's people who are elderly or have other preconditions that were dying. But of course, one of the huge groups of people to take a hit were those medical professionals. And what was really heart-wrenching is hearing them talk about how afraid they were of taking it home to their family, and how many of those health professionals basically just decided to quarantine themselves.
They didn't go home.
They didn't go home. They just quarantined themselves from their families because they didn't want to risk children, husbands.
Yeah. That I think the person you're referring to is Kitty. She was in New York in the middle of the pandemic working as an anaesthetist. And she's the one who talks about taking it home to my boy. But a lot of them had the same. Some people stayed in a hotel. Some people came home and undressed in the garage and then went straight to the shower and showered off. But yeah, tens of thousands of healthcare workers died from the pandemic.
Yeah, which is quite a crazy stat, really, isn't it? And I do think that needs to be said more. I think it's quite. I mean, we have healthcare shortages here in Dunedin, across New Zealand. It's how often is it in the news? Oh, we haven't got enough nurses. Anyway, let's not talk about that. We'll concentrate on one issue at a time. But yeah, I think just the personal toll that it took on those healthcare professionals. In when they were there was one guy there. I think it was in the Foreign Correspondent documentary that I saw after your movie. Sorry, I've got them all confused in my brain now because it did that whole thing where it flicks onto the next one. Anyway, he's in paediatrics, and he was like 6 months in hospital. I think that whole kind of long-term effect as well, and people like knowing colleagues that have died from it, but still going into work every day, and I think a lot of that was happening right at the start when no one had any idea how long this was going to last.
Yeah. We had a guy, Michael Schultz, who was a nurse, who was didn't catch it at work. He caught it at a rave, I think. But he ended up in intensive care. He spent a month on a ventilator, and you should see the pictures of him before and after, because he was a bodybuilder, and was big, solid, muscly guy. He looked like he'd been on a starvation diet or come out of a prison camp. At the end, he had sunken cheeks, he was dehydrated, he could barely stand, and this was a fit guy.
Yeah. And I do think it's kind of, I don't know, there's something in the human psyche that we don't want to quite be vulnerable to it. We don't want to admit that someone who's perfectly healthy can suddenly be so unhealthy. So we want to try and make it something, or they were old, or they were unfit, they had some precondition or something. There's something, I think there's kind of a societal, maybe that's just me.
No, I think I get what you're saying. Yeah, we don't want to think that it could happen to us. So we pick on we select the other that it might happen to, so that somehow we might become immune. Yeah, I think it is a psyche thing. Yeah.
I think it's like there's some sort of collective societal, we don't want to talk about it.
No.
We don't want to reminisce, sounds a bit weird in that context, but
I remember COVID.
Exactly, but I mean there's like to the effect that we just stop talking about it altogether, whereas it was a really big thing, even here in New Zealand, where for a lot of the time we were actually very well off compared to the rest of the world.
I think the fact that cameras and stuff couldn't go into the hospitals and film, people couldn't go into the hospitals and see, and healthcare workers tend to be naturally a little bit reticent, that people have forgotten what my colleagues did, how amazing my colleagues were and what lengths they went to. And now you've got all these, I have to say, nutters saying, the vaccine didn't do anything. COVID wasn't that bad.
Which is like a bad cold. And I was like, no.
The intensive care units in New York weren't full to overflowing. I mean, I interviewed people after they'd been at work that day in intensive care units, watching people die. Sorry, there aren't that many separate people making shit up. It happened.
It's so strange. And I would point people back, and I can't remember which episode it was, but the episode we did, now his name slipped my brain as well, on COVID. Sorry, not on COVID, on conspiracy theories. And it was...
the behavioural psychologist.
No, from the philosophy department. Sorry, I've forgotten your name.
Well, you talked about Karl Popper.
Yes, and he was talking about conspiracy theories and how you can tell one. And it's a really good point you make there, because that's exactly what he was saying. So he wrote this paper on how we know when it's a conspiracy theory is true or when it isn't. Because there's lots of conspiracy theories that are actually true, because it just needs 3 people to be conspiring on something.
So how do you know?
Well, it's the motivation that they have to keep it secret or to tell the truth about it. So they're not winning anything. Like if all of these independent doctors and nurses and medical care workers all across the world were somehow gaining from it, then you could say, maybe it's a conspiracy theory. But they're not. They're risking in order to tell the truth, right? So therefore it's evidence that it's unlikely to be made up, what they're saying.
I'm so glad you came on the show.
And because they're independent, right? So they don't all know each other. So it's lots of independent people rather than, and things that are likely to be a conspiracy theory are things where you've got like a conspiracy theory that involves thousands and thousands of people, and that you're assuming that they're all keeping quiet, like they're all hiding some government thing. And that's unlikely, because why would they? So it depends on what the motivation is of the person to keep quiet or not keep quiet, basically, and how many of them there are that are saying it. And I think, there's overwhelming evidence anyway that COVID happens. I don't know.
I'm sorry, but I wouldn't stand getting a COVID vaccination down a back alley in Musselburgh if I didn't think it was real.
It amazes me that people, and I think that says something about where our society's come in terms of believing things. And I think the distrust that we've now there's a distrust of media and a distrust of government that is, I think, more now than what I remember as a kid.
But it's fascinating because you think about, we had the Spanish flu, then we had the polio epidemics in the 1950s, and then the huge vaccine programs in schools in the 1960s. Anybody of any family that's lived in New Zealand over that time period, surely you must know your family stories, your family history.
I don't know. I mean, smallpox is the same. That everybody had the smallpox vaccinations.
Yeah.
But I don't know. I think there is something about people wanting to forget things. They were wanting to move on. I don't know.
I think that the really extreme nutters are really a very small but very noisy proportion. It's interesting that everybody is saying in America at the moment, distrust this, distrust that, distrust the other. In fact, the people they should be distrusting at the moment are the senior government people over there who really are raping the system.
Yeah, but it's so blatant. That's what amazes me. It's so blatant, like the mistruths, the lies, and the. I honestly, I'm gonna put another trailer on before I start ranting. Why is it not playing? There you go.
It's hard to feel like a hero when so many people are dying. You know what I mean?
I finally understand what it means to be a veteran, and people thank them for their service, but are you really thankful?
It seems like the same.
I want people to learn from this that the institutions that they trusted betrayed them. They're paid to be the ones that saw the Chinese doctors or medical workers in the hazmat suits wheeling the patient, and to look at that and go, ooh.
They sacrificed a lot of lives. Healthcare workers at the bedside were not protected.
No one I know actually refused to work because of lack of PPE, but that doesn't mean we don't remember.
Yeah, so that I guess is coming back to that whole failure of government to supply the adequate PPE.
And to see the signs. I mean, it's really interesting. Early in 2020, my partner, who's a doctor in Australia, she said, and I had said, this is going to be nasty. We should start warning people now. And she wrote this great page for her people in her Lions Club, and I then took a copy of it and circulated it around my friends, because they were all still going out and having meetings and saying, so when's the next meeting? And she said, there's not going to be a next meeting. We're going to be in lockdown, or if we've got any sense, we will be. And yeah, by the time people here in Dunedin were stocking up, I'd been stocking up for 3 weeks because I could see what was coming, and we could see what was coming. And the only thing I forgot to get enough of was flour. But it should have been. We were lucky. We had a government who saw it coming. We had a little bit of lead time over everybody else because we're so isolated, and Jacinda followed the advice of her experts.
I think also part of that following the advice of the experts was also the government, Ashley and Jacinda and everybody around them there, and again Susie Wiles was in actually keeping the country up to date with what was happening. With that, not. I think it was in a sort of reassuring way, because it was like, okay, we don't actually know everything about this, but we're on top of it. When we know more, we're going to change. If we know something is different, we're going to change. We're going to pivot to that. When we know more, we're going to keep on top of the information coming in, and we're going to let people know as soon as we know. And I think that communication and that kind of, that must have been hard work. That was a lot of, keeping up to date with all of that information behind the scenes, but then putting that big communication load on top of that. And I think that was amazing.
Susie was great. Jacinda was great. Ashley was great. I did try and get in touch with Susie about interviewing her, but I think she was just too busy. I didn't hear back. I'd love to interview Jacinda, actually, about the weekend where we went into level 4 lockdown on the Friday and then we went into level 1 lockdown on the Monday, about how that decision was made. But again, I haven't had any luck getting an interview with her, because it would be really interesting to hear about and to make just a little 10 or 15 minute documentary called The Weekend, about that weekend.
Yeah, I would watch decision process.
About how that decision process with an interview Michael Baker as the epidemiologist, interview
everybody was feeding into the decision. Yeah. Everybody was making the decision. I think that would be really interesting.
It's Dame Jacinda now, isn't it?
I think so.
I think so, yeah. Interview her and the other people involved in that decision, and just to put together a little string of interviews telling the story of how they made that decision, because I know from another interview that on the Friday they had not decided that they were going to lock down the country, and they made it over one single weekend.
Yeah.
And how you make a decision when there isn't actually enough information to make the decision.
I mean, it's weighing, for me, I think it's what they did a really good job of doing is weighing up what's the worst. I mean, we don't know. So we're looking at probabilities here. We're looking at lots of variants and unknown unknowns. We don't know what we don't know, as well as we know these things that we don't know. But also knowing, okay, if we get this wrong, what's the worst case scenario? Are we prepared to live with this? If we do this, it might be hard work, but actually, what's the worst that can happen if we do this? What's the worst that can happen if we don't do this?
It's a shame we don't take calls. I'm sure we get a few comments.
We might do. Anyway, hopefully we can work on something along those lines. Now, we've got one last trailer here for the movie that I'll just play.
Is it the same one as all the others?
No, it should be different. It should be different.
I'm teasing you now.
It's probably a gift that they can act like that because they haven't seen what we've seen.
If you don't think this is a serious disease, then come and spend some time in an ICU, seeing the wards filled with ventilated patients alone.
Yeah, and that's just, again, someone just talking about what we've touched on there with people not kind of really seeing it, I guess. And I think that I just feel like for those people who were there, who were seeing, one person was saying, I had 6 people die that were in my immediate care this shift. And I was just thinking that just must be just like...
Shit. Sorry, am I allowed to say that? Yeah.
It just must be so hard on your mental health and your ability to go back in day after day, and that really is the sort of thing that happens in war. But then in war, everybody's in war where you are, and then you go back out on the streets, and then there's people like saying, I don't want to wear a mask.
So their resilience must have been impressive, to say the least.
I think so. And there were a couple of points
anybody, I think, working in health must be quite resilient, I think.
I think so, yeah. But I mean, a couple of points in the documentary there, a couple of the people were saying, how much they relied on their co-workers. And I think there is that kind of, everybody was in it together, at least in their workplace. And so they were relying on each other quite a lot there. And I think that also makes it doubly hard when someone that you're working with then dies from COVID. So I think there's a plus and a minus to that.
Yeah, there are several other people in the film lost colleagues or looked after colleagues in intensive care.
Yeah, no, it's anyway. Have we got any takeaways? We're winding out to the end of today's talk, Paul. The last.
How time flies when you're having fun.
Yes. So, last comments from yourself.
The reason I made the film was that I thought that there would be a strong will after this had passed to forget the sacrifices and the lengths my colleagues had gone to. And more through luck than prescience, I guess, I was right. And the reason I decided to put the film out on YouTube for free was that I was so incensed at the hard time that Anthony Fauci's been getting and the number of nutters, and I can really only describe them as nutters, or perhaps misguided people, have been posting on YouTube and Facebook and Instagram about how Anthony Fauci should be locked up.
It's ridiculous.
He should be charged. This is a guy who spent his entire life dedicated to improving the lot of everybody, including the people who don't like him, and who did the absolute best with poor information in a situation that most people would just curl up and die. There is no reason to be slagging him off and challenging him. And all of this stuff that came out of a lab in Wuhan is bollocks. There's really strong evidence now that it didn't. And, watch the film. If you think that COVID didn't happen, and you don't believe we got off lightly and that it was all a conspiracy, watch the film and see what it was like to actually be there.
Thank you very much.
Oh, I just want to give a shout out to all the former Greg staff. The factory officially closed yesterday. They were an essential industry during COVID, but now they've gone. So
that's sad.
It's just a reminder about how things can move on quickly. So I think it's really valuable. Watch this and remember.
Yeah.
You've been listening to the OI podcast, the shout out for the arts, sciences and Mataranga Māori.
You can support this podcast by becoming a member of the OI. Check out the Otago Institute for Arts and Sciences on Facebook or our website.
If you'd like to listen again to this episode or others from the series, look for the OI podcast on ORFM's website, oar.org.nz.
Brought to you by the Otago Institute for Arts and Sciences, the Otago branch of the Royal Society of New Zealand.
This podcast was produced by ORFM Dunedin with support from New Zealand On the Air.